I want to talk about the fruits of labor during the placental separation and the placental birth. So, after the baby is born, when we are waiting for the placenta to be born, it's very important to not interfere with the created atmosphere, with the altered state of consciousness. As Audin says, it's important to not wake the mother. Meaning that we will leave her in this altered state of consciousness. We will preserve the sacredness of the moment, and we will not raise our voices, speak loudly, be very excited, take pictures, start to clean up the room, or make any major shifts in in the ambiance. So we will wait for the mother to have her return. She will, take care of her baby, be with her baby. We will wait for 3 contractions. So the placenta is born with usually 3 contractions it takes to separate the placenta from the uterine wall. The fruits of labor. First, when the baby is still inside, the womb is watermelon sized. It is long and and big, and the baby is still inside. So it's also important to note that with every contraction that tries to bring the baby down, the womb does not blow up like a balloon, like up and down, like in this kind of contractions, but it contracts, and the baby is out, and then it stays contracted. It's like push out, but it does not go back to like a bigger size. So the womb stays contracted at the size at the around the belly button. We have, after the birth of the baby, size of a honeydew with a disc, like it's large disc, not very round, but rather that we can feel like a disc, a plate shaped honeydew. And then, so that's when we have this shape, we know that the placenta is still attached at the upper uterine segment, or is still attached to the uterus. Then when we have these contractions and the placenta releases from the uterine wall, we have 3 contractions. Maybe there are more to follow, but usually with 3 contractions, the placenta is separated. The uterus rises above the belly button and becomes very hard and roundly shaped, hard and very hard contracted, in the shape of an orange. That is when the placenta is released from the attachment to the uterus. In the upper uterine segment, it's released and it drops down into the lower uterine segment. So this does not take a very long time. The shape of an orange, when it's very hard and like above the belly button, it drops down again and stays about 2 fingers under the belly button, in a grapefruit shape. When we have a grapefruit shape, we know that the placenta is released and has dropped down into the yoni, even if it's not birthed yet. Okay, and then it will stay grapefruit sized and about in this position for the next 2 weeks, and then eventually contract more. Yes. It's important to note, or what I learned also, that there is no scar in the uterine lining, in in the uterus where the placenta was attached, if there's no intervention to separate the placenta from the uterus. So there's no scar. The healing will be scarless. Okay. What else is there to say? The separation of the placenta, usually the placenta just drops down into the yoni and is birthed and comes out in like an umbrella style, with the fetal side presenting first. But there's also the possibility that part of the placenta like comes off of the wall, and then it's like drops into the yoni, and then the rest will come off, and so it's like it falls into upside down into the yoni, and the maternal side would present first. That would come with more bleeding and with the risk of having placental tissue still attached in the womb. Like it would necessitate to be very careful about all of the tissue, and also the bag being completely out of the womb, like that there are no remaining tissue inside the womb. Oh yeah, and if there is part of the placenta that was attached into the lower uterine segment, then we can also expect more bleeding, because the lower uterine segment does not contract as strongly as the upper uterine segment. So the contractions of the upper uterine segment closes the blood vessels that were attached to the uterus and assuring the blood flow. So the blood vessels are closed down by the contraction of the uterus, and the lower uterine segment does not contract in the same amount. So we could expect more bleeding if there was attachment in the lower uterine segment. Is that all? I think it's all. Or did I want to add something else? Yeah, the cord clamping. I wanted to mention also that I learned that immediate cord clamping can delay the birth of the placenta, because the placenta, when the cord is not clamped, the blood will just flow towards the baby, and the placenta will normally, as a result, contain less blood. So it will also become smaller and retract and give the signal to release, so that the womb will release the placenta. And when the cord is clamped and the blood stagnates, it engorges, the placenta engorges with blood, and it has nowhere to go, and it stiffens and delays the process of separation. And I guess it's also giving not the physiological signal to the body, because it's like, okay, is yeah, what's happening? So with the stiffened uterus that is blood engorged, the separation is impacted. That's all.